and I can try and answer them for you. So shall we start with Gail? Can we unmute Gail?
Unmute. Okay.
Yeah, that's good.
I'm unmuted. Well, I am not pregnant, and I don't have to worry about gestational diabetes, but I got a lot of tips just for me at my age. So it's wonderful. I'm going to change some things. This is good because I love bread. But yeah, I thought it's excellent. Belize has 1/3 of its population where I live in Belize, Central America. 1/3 of its population has diabetes or pre-diabetes.
Yeah.
I need that video so that I can start running around to all my little clinics that I deal with, and I can share it because they don't understand it. The problem is the people that are working in diabetic clinics don't have any medical background, really. They're being fed the information from doctors. And so the doctors are saying, well, just tell them to change their diet, tell them to come to me for tests, tell them that they're going to get bad feet and get their legs cut off. But they're not, the people that are actually running the clinic are basically like just people that care because they have a diabetic mother or they have a diabetic sister, but they don't have enough information to talk the language.
I think that's missing in our midwifery education, and what we're trying to do with Lily and you guys is that we're going to load all these prenatal education videos up onto our education platform, and women can actually, I mean, they maybe just pay a very small subscription or something, but they can watch the videos at home with their families on the TV, and then we're educating the whole wider community. Because I was never taught this in my midwifery training. You know, my midwifery training was very medical. It was like, you know, here you are, 24 weeks, here's your blood test, let's pray it doesn't come back normal. You know, if it comes up normal, I just refer you. So this is not reducing the problems and the issues. And that's the way it's just been meant to be, because we're kind of run by the drug companies, you know, and we're very much controlled into the education we can give. So we're going to open that and change that, because we'll have more women having normal birth, and, you know, having more forums like this and talking to everyone, because I think, you know, the diet's a bit different in each side. So if you can be prenatal educators, you can show these videos, you can have discussions about diet according to the locality, you know, of women, and educate them more. We've got like, there's more on it, because we do like the nutrients in pregnancy. And one of the things that is on the nutrient one is a thing called nitric oxide. How many of you know about nitric oxide? Yeah, nitric oxide. If nitric oxide, it balances the blood flow between mother and the baby, because it dilates the blood vessels. Yeah. So what happens is if you're eating a lot of unhealthy fats, if you're stressed, it reduces your nitric oxide levels, and therefore it constricts the vessels, you know. So if you think of placental maternal blood flow, and then we get the IUGR babies, we get the preterm births, and just by having that knowledge, we can prevent these things. So like, if you're giving too much iron supplements, then if you have too little iron, you're prone to hemorrhage. Yeah, so it works the other way. Too little iron you'll have increased nitric oxide levels. Okay, but if you give too much of it, you can decrease the nitric oxide levels and cause the issues of high blood pressure and things like that. So it's important to apply the physiology together and to look beyond what we have in front of us in our universities. You know, the information I got was looking outside. Some of this information I even got from physical exercise researchers and things like that. So we have to look beyond the midwifery box to find what we're looking for. So I kind of quite enjoyed gathering all this information and putting it together with my curiosity. So a lot of the work's done. The books will be split, yeah, on our Lily site, so that it will be part of the midwifery education program. So I'm pleased that you've all picked something up from this because I knew it was things that my women missed, and I had so many Indian ladies or ladies from, you know, from Africa that were eating lots of rice, lots of breads, and the diabetes was very high, but I've managed to kick that down to lower it. So sharing this information, I hope that you can take it away with you and do something. Okay, so who's next on the thing? Let's have Louise. Put your microphone, Louise. Turn your microphone on.
Unmute.
That's it. I can now, yeah. Okay, so how did you feel?
Put me on the spot.
Ah.
Yeah, I love it, especially for me as like an upcoming future midwife, as a student. All this information just gives me confidence that I can go out and practice and share with women, educate women, and we're going to be creating like a partnership that's based on like trust, and it's based on respect, because I'm not judging the woman as I advise her about how to eat healthy. I'm not judging her her culture, because she might enjoy eating all those foods you talked about. Yeah, it just gives me a way of me to confidentially like have a relationship with her where I can advise her to stay healthy and avoid diabetes in a way that is healthy for her and her baby and her family for the future long run as well. And my other question is, how can, because a woman will go home and we don't know what they do. We don't know what they put in their mouth and what they put in their food, despite the advice we give them. How can as a future educator, how can I make sure
Okay.
Well,
at every prenatal visit, when a woman comes to me, I ask them, what do you eat for breakfast, lunch, dinner, and tea? It's a simple question. Yeah. What did you eat today? And often if my ladies come from India, they'll have some Indian tea with some sugar in it and a biscuit. No. So then you can start and use this knowledge and explain what's happening with their body. I think the key is when they understand their body and what's happening with it, they are happy to change what they do. Yeah. It's if you just turn around and say, well, you don't eat the sugar, you know, don't eat this, it's bad for you. You need to walk like this. I think women sometimes can see that as a threat to their lifestyle, but if you actually explain what's happening with their body, they really think, oh, I can see this picture. You know, you draw a little picture, show them the my plate, show them the diagram. You know, a lot of my girls maybe eat like a salad sandwich, but there's no protein in it. So then I keep saying, well, your blood sugar levels are going to be out of balance without the protein, because the protein really balances those blood sugars. And that's the key, I think, is having that balance. And I also talk to them about mood swings, because you find women that really don't eat the healthy diets, their mood swings go up and down as well. So they can be quite bipolar. They can go like from heights of being really energized. That's when they first eat something, and then it will drop to rock bottom, and that's where they go depressed. So if blood sugars go up, yeah, you get high, you know, they get like fallen hyper, and then it suddenly burns off and crashes, and then they can get depression. So I think that when we talk to them about their body and how it works, we get the messages through.
Thank you so much.
Yeah. What about Anita? Hi.
Hi. Okay. I think this is I'm sorry, my English is not too good, but I will
Okay.
try to say something about diabetes in my country. This is an interesting topic, but in my country, there's actually not enough case of diabetes in pregnancy. I'm a midwife and I'm an educator, but because in this country, glucose test is not routine test that is
Yes. Yes.
recommended during pregnancy. So
Mm.
sometimes we think that this is not important, but there is case macrosomy like or other impact from diabetes happen in delivery. I think the regulation during pregnancy to prevent diabetes is very important to do. But in midwifery curriculum, we don't have enough to teach to the student. So
Yes.
sometimes we difficult to try to educate our patient about
Yes.
the diet regulation. I hope in this workshop you can share how you can educate the patient in that.
I think, you know, one of the things you can do is if you work with Lily, we can maybe translate the slides. I have the slides in Chinese, okay? So it's very easy to translate them for you to be able to have them available in your own local language, yeah? So that means you need to get a team together and also look at the foods, because you can put your cultural foods on there, yeah? Your healthy ones, and do it that way. The other thing I find is that, you know, I can see someone who's starting to develop diabetes just by looking at them. Yeah, because their face becomes shiny, their skin, their abdomen is really shiny. Okay. So you can see that look and that little rounded look on their face, and it's just very shiny on the forehead, the face. It's like a shiny apple, it starts to get like a shiny apple. And that's one of the signs, especially with if their feet swell, you know, and you know, if the blood pressure and everything's fine, you know that these swelling feet and the changes in her face is due to her diet. Okay, so you need to open your eyes, and you know, when you do continuity of care and you see the same woman each time, you can see those changes. And I think Louise will be doing that in New Zealand. Okay, so you know, instead of, you know, I see midwives and they're jotting all the things down on the computer and passing this out, and they don't even look at the woman. They don't notice these things about her. You could notice a protein deficiency just by looking. She'll have flaky skin on her face, you know, or the lines on her nails. So, you know, it's like bringing back these clinical skills that we've lost through academia, you know, that we need to bring back onto the shop floor. And hopefully out of these courses that I'm doing with Lily, I've just got a new post as head of Midwifery Council with the Wakatamanga Maori government, and we're setting up that new midwifery education there and bringing back traditional midwifery with those clinical skills into the forefront. So, you know, we can all work together, and the beautiful thing about doing this is that we come from different parts of the planet with different cultures. So, you know, you can be educating me with what it's like in your country. So I learn all the time when I speak to all of you, okay? So that's something that we can arrange with Lily to make it possible in your country, yeah, with you. If you get a group together, we can do that very easily, because the work's there, it just needs a bit of translation. And it's easy to do the PowerPoints on MP4 with PowerPoint. We've got this technology, it doesn't cost much to do it.